Good afternoon and welcome to CAN TV, Cable 21. My name is Lucy Aquino and I am with Hispanocare, affiliated with Advocate Illinois Masonic Medical Center. And today you are watching a live interactive show. The lines are open and the numbers at the bottom of your screen. Today's topic is chiropractic and holistic care. And with me, joining us today, is Dr. Edgardo Vargas. Thank you for joining us.
Thank you for inviting me.
Wow, this is wonderful. It's a topic that we really don't spend a lot of time talking about. But chiropractic medicine is really something that goes back many years back.
Correct.
Thousands of years back, to be exact, and it does go back. But chiropractic medicine still is not as known today as well as it could be.
Correct.
But Dr. Vargas, can you tell us what is a chiropractic medicine? What exactly is a chiropractor?
Absolutely, and I do this with every single one of my patients. I just want them to understand what is chiropractic all about. And while it's for 1,000 years, we know chiropractic is being in existence, and it's been 120 years and being formed as a science.
Right.
So when we think about chiropractic is a art, it's a science, and a philosophy itself. And what we're looking with chiropractic is to allow the body to function better. And then everybody think about chiropractic. Chiropractic is about adjusting the spine, cracking the bones, which is true, we do that one. But the main purpose of that is to allow the body to function better, to the muscle to have better circulation, better nerve conduction, and for the body to be more efficient, so in that way it could be healthier. So it's going straightforward for chiropractic. We use our hands to manipulate the body,
Right.
And we know how it works because of the science.
Right.
The art is the way we manipulate the body, and the philosophy itself is that our body, when it functions better, is healthier, and then that's what we want to accomplish with chiropractic.
Oh, absolutely. So how many years have you been in practice?
I've been practicing for 9 years.
Wow.
Yeah.
Okay, that's a long time. So chiropractic medicine, I mean, it is something that obviously for a host of different reasons, there are reasons to go see a chiropractic specialist such as yourself. But how does someone really go find a good chiropractic physician? I mean, there are hundreds all over the place and on the internet and so on. But how do you find a good one?
Exactly. That's an excellent question too. And I would say chiropractic, every single chiropractor can practice in different ways. And we have one that dedicate only for lower back. We have one that do headaches, other one that do digestion problems. So chiropractic, because we allow the body to be more functional, and you can apply chiropractic with a lot of different conditions. So if I give a recommendation to find a good chiropractor, and it's good to read in the internet or find out who they are, but just talk to the doctor, call the office, and it just ask the question about what is specialty, what they specialize. So one is specialized in overall the whole body, and someone is specialized in a specific condition. Someone is a car accident, a workers' accident, like work compensation accident, which is a very specific way we need to treat these cases. So just call the office and just ask the proper questions, and then tell them what is your condition, what is your goal, your health goal. I learn from the doctor and the specific technique. It's sometimes frustrating to patients when they go to our office and the doctor get treatment for a lower back, but in reality the specialty for headaches. And so it's not going to be 100% attention for the doctor to just treat the lower back. So and that's the beauty of chiropractic, as we can allow the body to function better. We can treat different conditions.
Right.
And so it's that one, looking for what the doctor specializes.
Okay, so different chiropractors then specialize in different things.
Correct.
Wow,
Correct.
that's interesting. I did not know that.
Yeah.
I just figured chiropractor was just everything.
Yeah,
But they do have some specialties.
Yeah, they are a lot of these different ones. And the main one will be orthopedics. They're very good at treating pain. But these doctors, they have diplomates, and they work directly with surgeons on how to re-stimulate the body and the area of the body is affected. There is digestion, nutrition, there's a lot of nutrition. For pregnancy, we actually in our office see pregnant women, either infertility or post or after or before they're having the baby. There is pediatrics. We see kids in the office as a certification that we have to allow the kid to function better and be healthy.
That's awesome. So how does holistic care tie in with chiropractic care? Are those two one? Or is it really two separate things?
It could be two different things, or it could be one. So when we define holistic in healthcare, mean treating the body as a whole entity.
Okay.
So instead of seeing the body as a different pieces. So if you go to a chiropractor, they only treat lower back or dedicate to pain. So it's not going to look at the whole body and decide, is this affecting the body in a way that's creating more pain.
Right.
So when we look at holistic, we look at the whole body. Chiropractic itself, we're going to the main chiropractic purpose will be to see the area of the problem and then to also look in how the body is not moving correctly or functioning correctly, is influencing that problem.
Okay.
And that's how chiropractic and holistic align itself. When we look at the body itself, so well, let's see somebody had come with a hip pain, but also had digestive problem. If there is a connection, so we look into the whole system, and if we find a connection, and we can treat the hip pain, and then subsequently the digestion can improve too. So that's how we align those one into the chiropractic holistic concept. Yeah,
Holistic.
in the whole body.
Okay. So I know that chiropractors also treat a host of different conditions as well.
Correct.
But in any given office, what are some of the things you do treat?
So most of the population, no chiropractors treat lower back pain.
Okay.
And so we are very good because we allow the muscle to work better, the joints to move better, and the body start healing, and we get back pain out of the way. So, but we look into that part, anything that affects the muscles for nerve, sciatica, back pain, disc problem. We have neck pain and headache related to the neck pain, shoulder problems. So we can see all a range of neuromuscular problems. We do not treat, for example, digestive problem, but if we find a connection between the nerve of the lower back and the digestion, we can see patient improving. And we are very good in treating accidents as we understand the mechanism of the injury and how it's related to the spine or the joint and treating the nerve. So in my office, we can treat any pain, or we can see if by treating the body, we can make other conditions better.
Okay.
So, yeah.
So car injuries, sports injuries,
Yeah.
you mentioned headaches earlier as well.
Too, correct.
Because we know that migraines, actually are huge. People are always affected. Many people are affected by migraines.
And one of the beauty of chiropractic and migraines is that we find the root of the migraine in the neck, and then we release that one, the migraine slowly starts melting away. And then so we look in the holistic concept, so that's the mechanical problem, right? The neck. And then so we start looking into maybe diets affecting this one. Maybe some problem with in chemicals.
Okay.
And so when we start and see those connections and advise the patient to avoid those ones, when the neck start getting better, we have great result with migraines.
So what you're basically looking for is you're looking to find the trigger of the migraine, and then you eliminate the process.
Exactly.
It's always the bottom line is where do you find that trigger, how to find it. And a lot of times we ourselves don't know how to identify it, because really, how many people actually will stop eating or doing something they normally wouldn't do, or try something new and say, I don't remember anything different, but my headache always comes on about this time of the day, or sometimes, but you can narrow it down.
Exactly, and that's the main goal when we evaluate a patient, is to determine, all right, so it's the mechanical process. Let's go step by step and trace is anything else is affecting. In the case of migraine, let's see if any trigger, more trigger than just having the mechanical problem.
Right.
And that's when the doctor comes and they do the evaluation and do the process to find out how to educate the patient. So if they want to get better with the problem, so they can do these lifestyle changes.
Sure.
Because in reality, chiropractic is a lifestyle change.
Right.
So we look to, if there's a symptom, we look to resolve that symptom. We look to educate the patient and help the patient to be healthier. And from there, educate them so they can continue in that lifestyle change. And we're there to support the patient to be healthy, to feel better.
Right.
So that's the main goal.
Oh. So I want to remind our viewers that today with me is Dr. Edgardo Vargas, chiropractic doctor, and we're talking about holistic and chiropractic care. I want to remind our viewers that our lines are open. If you have any questions for Dr. Vargas, please give us a call. The number's at the bottom of your screen. So, Doctor, chiropractic, you alluded to some of the things, but how does chiropractic care help keep people healthy? I mean, you said some things, but how does it really keep you healthy?
Yeah, so it's a long story short, right?
Okay.
We have the brain, very important organ in our body.
Right.
And we know since we're in 5th grade that the brain is the most important organ that controls everything in our body, through the nerve, through the spine. So then we had the spine and the skull, and the spine there is there to protect that important system, the nervous system and the nerves, all go around. So when the nerve communicate with the brain and the brain send information to the body, our body can function optimally, right?
Right.
So we're born, we have a perfect body that's growing healthy.
Right.
And then so we can have stress, we can have maybe poor diet, we can have accidents through our life. They can interfere with a proper connection between the brain and the body. So what happened there is that as a chiropractor, we try to identify if there's any interference that is not allowing the body to function properly. And then so what we can find symptoms with chiropractic, what we allow is the brain to really send the information to the areas of the body that are affected so the body starts getting healthier.
Right.
So what we chiropractic, what we do, we support the body to be healthy. And at the end, it is the patient's responsibility to stay healthy, right?
Absolutely.
As a doctor, we are
Absolutely.
teachers, we are educators, and we have techniques and treatment that we can give to the patient. But it's the education there. So it's a very small thing that we do as a chiropractor.
Right.
We do the adjustment, we educate the patient, maybe there's some supplement, maybe some
Right.
lifestyle changes.
Right.
But when we do that part, the patient understands they're getting healthy, so they start doing these lifestyle changes. Then we will combine it with the chiropractic care when it's necessary. We support the body ability to function better, be healthy.
Right.
And that's aligning directly what we were talking holistic,
Holistic, right.
chiropractic.
Right.
So there's the same concept.
It's everything.
It's everything.
It's one
correct.
package. So I know that many times the question has come up for children. Children do suffer of many different things as well. Is chiropractic medicine good for a child?
Yeah, and I will say this part as an experience as a father. I have 3 boys. They're very good, very healthy, and they're not. They get sick. They get the nose running and
Yeah,
everything.
right.
It's a normal thing. But when they were born, right away I put my hands on them, and then the first time, a couple of nurses were a little bit concerned of what I was doing, right? But so when we look at chiropractic and kids, which is an excellent way to keep healthy, is because what we do as a chiropractic is to allow the nervous system and the body to function. Now, I will continue to mention the function concept because when we
Right.
think about it, when we function at full potential, we are healthy, feel great.
Right.
And when we start having health challenges, we had to think about my body's not functioning properly. Like when we start having headaches, my head, the circulation, the conduction in there is not functioning properly. So what we want with kids is to see, when we see kids, we see healthy kids, we evaluate the spine, we find any interference, we just gently manipulate it,
Right.
and they will allow the body to function better. We don't look into the big wow, right? Aquino gonna look at you and say, "Hey, thank you, that was a great adjustment. I don't have a headache," right? But we see that we understand there's a proper response with them. When they're
Right.
baby, they just get very excited. When they're growing, they, I have a 7-year-old and I'm adjusting weekly on a weekly basis. He's still looking at me like, I don't know why you're still doing this. And eventually he will get it. So what we want is to allow the nervous
Right.
system to be more
Right.
efficient.
Right.
And that will help the kid to have better immune system, to be healthy, to move better, and to prevent the body to be healthy. As
Wow.
chiropractic is more proactive.
Right.
We want to prevent other than being reactive
Right.
when you have the problem.
So obviously we're always looking for prevention. I mean, the more we can
Absolutely.
prevent and better adhere to care, I mean, the healthier we're going to feel.
Absolutely.
Well, that's a lot to take in, and it's good to know that children in need can obviously get chiropractic
And the
care.
healthy one too.
Right.
The
Yeah.
healthy one too.
Yeah.
The one
Main
healthy
thing
kids
that.
to stay healthier.
So, but there's also a thing such as when do you not seek chiropractic care?
Absolutely.
When someone does not, right?
Absolutely. So as a doctor, right, my responsibility, right, any
Right,
chiropractor,
right.
any healthcare provider, is to make sure that any treatment that we serve the patient is safe.
Right.
And if we go directly to chiropractic itself and the chiropractic manipulation, the main treatment of chiropractic, what we need to prevent is to create a damage within the joint we are adjusting.
Okay.
Chiropractic is very safe, but for example, we should not do any treatment in a joint that have an infection. Any patient that have bone cancer, someone we might be able to do treatment, but in after cancer, we don't want to stimulate the body to function more that the cancer is doing. So we want
Right.
to prevent damage they could be created because of all the problem.
Right.
And we have cases of severe neck damage, so we have to be very careful of that part. But at the end, is each chiropractor or any doctor responsibility to evaluate the patient and do the proper testing to determine the treatment they're going to be performed is going to be safe. And so, but we have some conditions that absolutely is a no-no.
So that absolutely a no-no. So, chiropractic care is not for everyone, especially if cancer, for example, is a potential.
And some type of cancer, I would say bone cancer itself, bone cancer itself. So, as a not all the technique of chiropractic are the same. So we have gentle technique that we're not going to be moving stuff the wrong way. But yeah, so we have some bone cancer that we have to be very cautious about it, and active infection and everything. Anytime there's a doubt about giving a treatment, so it's good to evaluate and make sure that it's appropriate. But yeah, there's some cases that we have to say, you know what, this is the route you have to follow before you can engage in this type of treatment, and we have to accept that.
So when you're getting a new patient in your office, or a new doctor is getting new patients in their offices, I know you have people fill out a questionnaire, and obviously that questionnaire is to get a sense of why they're there. Correct? So it's very important that I think that individuals even going to see a chiropractor for the first time, because a lot of times, even when we go to see our own doctors, we forget why we're going, or remember one of the three things, or not remember anything at all. It doesn't, gee, I remember I was supposed to come in. But it's always good to write down those questions, too, before you get to your office.
Absolutely. It's that connection, doctor to patient connection. We allow that connection there. We allow for the patient to have the best care.
Absolutely.
And we really struggle the patient right down there. But still, it's a responsibility of the doctor to grab more information for the patient and then to evaluate to make sure it's appropriate.
Very important. Very important. All right, so I also hear that now. Once you see a chiropractor, you always have to see a chiropractor.
I love that
question. Is that true?
I love that question. Personally, let me start with my part. Personally, I want to see patients every month. Healthy patients every month. I want to evaluate the spine, make sure there's no interference. We find that one, we do a specific scientific treatment there. But in reality, nobody has to do anything. A patient doesn't want to come in, cannot come in. I'm not going to force, no doctor should force any patient to do any treatment. But when I say that I want to see a patient monthly, well, I have a purpose for that. No, I want to keep people healthy, keep people that are healthy, healthier. So I'll explain that to the patient. Personally, so I have plans. When somebody qualifies for my care, I have the plan. When they get better, that's an end. So we have a beginning of the end. But I give recommendations to how to maintain, how to be proactive about their own health. And so I explain that to the patient. We go through the process, and we recommend it. And any doctor can do this thing, right? It's like somebody say, well, you go to the dentist, then you have to go forever. Well, there's a purpose, right? You want to keep the
you have to go for cleanings every 6 months.
Exactly, right? So it's the same thing. So we create maintenance. So how to keep proper hygiene with the spine, maintain it moving properly. But in reality, nobody has to do anything. And then my patient that I've seen for 5 years, I think the oldest patient I haven't seen for 8 years now. And so she's still coming, and I still ask the question, why are you still coming here? What's going on? So they understand, they explain me why. I understand they have to take care of my spine and everything. And that's but it's true, and it's not true. So not everybody chooses to come in.
So it's about prevention. It really is about prevention and maintenance,
Correct.
So it's a good thing to do. So does acupuncture play a role in chiropractic care?
Absolutely, and acupuncture is way older than chiropractic. Actually, chiropractic, and while we have documents that it's been for thousands of years, and it was actually founded in 1895, so 120 years ago. And acupuncture, we can trace all information back to 5,000 years ago. And it's a fantastic technique. It's a whole entity. I mean, we practice acupuncture in the office, but it's similar to chiropractic, but the science is different. Acupuncture works more with the circulation and connection between the organ and the body and the patterns of energy within the body, which is very accurate. It's amazing. But it's the same thing. It's a holistic treatment. It looks at the body. Some acupuncture can treat pain, and some acupuncture can treat the whole body. So we see it as something that is by itself a tremendous technique, and also a technique that complements chiropractic too. But it's a completely two different parts. We have a lot of chiropractors that practice acupuncture because they understand how
it really does work. I never thought it did until I tried it actually, and it actually does work. Dr. Vargas, I know that another big question that comes up often, and lately more so than none, because I'm seeing more and more of it, is that can someone who wants to lose weight and has weight barrier issues and is having a hard time in losing that weight, and they've tried everything else. Does chiropractic medicine really help that?
Yeah,
Really?
yeah. We have to, and so we have somebody with weight problems, and we see in two ways. So we have the mechanical, the nervous system, the connection between the organ, the metabolism, the thyroid, for example, or the digestive system. So when we evaluate, we want to make sure there's no interference to those organs to function properly. And so we chiropractic can support that one. Now, weight is a combination of different aspects in our health. I always see weight at three important components, which is the emotional component, there is the dietary one, and then we have the physical one. So if we improve the physical body, the patient is able to engage more in exercise. And if we allow the spine to be more efficient, and the connection with the organs, so we can absorb better nutrients. So chiropractic, I will say, it will support somebody to lose weight,
Right.
and there's a direct connection within the spine and the weight problem. And usually we find those one because weight can create stress in the body, and stress will manifest to the nervous system, and then we have those connections right there.
Right.
So if for somebody like the first question you asked me, so somebody that want to use chiropractic for weight loss, for example, which is chiropractic does not treat weight loss but support weight loss.
Okay.
It's good to ask the doctor, do you treat it? How is the connection? Can we evaluate in a way that chiropractic can help me reach those goals?
Oh.
But yeah, there's a direct
Okay,
connection.
oh, that's awesome. Dr. Vargas, I did want to remind our viewers that if someone needs to get a hold of you, they can reach you, Dr. Vargas, at what number?
773-279-9344.
So if anyone had any questions for Dr. Vargas and wanted to give him a call and just talk to him off the air, you can reach him again at what number?
773-279-9344.
And I know you're Pro Holistic Healthcare and Physical Medicine located at 2609 West Lawrence here in Chicago. Again, thank you. I think we have enough time for one last question, and it's just our time here goes by very fast, and we always want to cover so much more, and this is such interesting information to share with our viewers, especially in chiropractic care. So there are a lot of chiropractors out there, and what really makes one different from the other?
Oh. So
This is how we're signing off. How does it really make a
that's the
difference?
toughest question I have right here. So it's most technique. I will say I like the purpose. It's what the doctor want to accomplish, right? I will hope that every chiropractor want to accomplish health to the patient and that patient to reach the goals. If we are healthy, we're good. We're unstoppable. So there's a lot of chiropractor with a lot of education, right? We have great education. Someone go far beyond that and get more educated itself. But it's a specific connection between patient and the doctor.
Right.
So I have patients, they maybe they don't feel that connection, and they say that, you know what, doctor, maybe I love the chiropractic, but maybe I want to look a different route, and that's good to know, right? We don't want to force anybody to get a treatment that they don't feel is helping them. So that connection with the doctor is excellent. But it's the matter to understand the process, to understand if there's a connection directly with the doctor and how the doctor can help them through the education. So in turn, that patient can decide, yeah, you know what, I want to do that treatment because you explain in a way that I know I'm going to heal, I'm going to feel better, I'm going to get it. So it's still a hard question. I feel I haven't answered that question itself. I feel like a great doctor, but and there's a lot of great doctors around. So,
Yes. So, Doctor, on that note, I do want to backtrack. Last week we were here with Dr. Andrew Albert, and we were talking about colon cancer because March is Colon Cancer Month. I do want to remind our viewers, too, that we have at Illinois Masonic Medical Center March 28th, we have a free colon cancer awareness lecture. And we're going to also have a colossal colon where individuals will be able to walk or crawl through one and see polyps and all of that. It's called a colossal colon. But refreshments will be served. Lecture will be available. It's Saturday, March 28th. Registration starting at 9 o'clock. If you're interested in coming and like to register, you can call Hispanocare or Advocate, 1-800-3-ADVOCATE, and ask for code 9C73. Or feel free to call our offices toll-free 844-414-7979. Dr. Vargas, again, our time goes here quickly. We'd love to have you back, and
Absolutely.
I know there's a lot of things that we want to talk about and share with our viewers. So, while primarily focusing on treating neuroskeletal disorders, chiropractors are not exclusively limited to problems with the nervous system or the musculoskeletal system. Remember that a chiropractor uses a variety of non-surgical treatments to treat patients. Yeah. On behalf of my colleagues at Hispanocare and Advocate Illinois Masonic Medical Center, thank you for watching. Until next time, please stay tuned for a lot more information coming your way. Have a good evening.
Thank you.